I think it's important to find someone I trust because they're technically saving my life when I stop moving, basically.
My responsibility with regard to Matt is making sure that principally his tracheostomy is working and his breathing is at all times functioning. In addition to that, I help him run his life in as normal a fashion as possible, helping him with the physical things that he can't do, such as picking up a telephone, using a mouse on a computer, clothing him, bathing him. I'm his safe pair of hands.
It is a very personal job. You have to get on with the person you're working with because they're with you 24 hours a day sometimes. You have to have a sort of personal relationship with them, or the dynamic just doesn't work.
I've not done specific care work, but I'm a father, so I understand about the ins and outs of body functions and things. I'm also patient with Matt's condition, being unable to do things physically for himself. A degree of patience is essential.
And I found it quite good. Actually, he has no previous experience with care, which is sometimes a good thing. Maybe that and bad habits, start with fresh minds, so that's great. My other PA, Lisa, who's just done her training, and she has actually done care work before, which is beneficial because she knows the ins and outs of things.
Matt's very good to work with. He's very patient when you make a mistake. Different circumstances throw out different challenges, and he can guide me and the others through difficult things as and when they happen, particularly with the use of slings and the pulleys. It's never intimidating because Matt is there to help in the process of me helping him.
Try and make it sort of relaxed because it can be a bit nerve-wracking for new carers when they come in.
With Matt, I do his tracheostomy training, and that involves how to change an inner tube, caring for the stoma, dressing changes, neckties, and suctioning the tracheostomy. Today, Lisa, one of Matt's new PAs, is going to shadow Patrick on a shift. Just before she started that, we've recapped the training of 2 days ago. So she was showing me how much she remembered about how to suction a trachea tube.
When I came on Tuesday, I was really, really worried. Because I've got 7 years experience in all care anyway, the only thing I haven't come across is the tracker. But Julia was fantastic as the trainer. She just covered everything so thoroughly that I'm really confident with working alongside Matt now.
In order to delegate a healthcare task, I need to be confident that the person that I've trained is able to deliver that task safely. Bearing in mind Lisa did her training 2 days ago, and that 2 days ago it was the first time she'd ever done it, she did really well. She was confident and calm. She had 1 or 2 little questions she wasn't afraid to ask, and that's really good. Much rather people ask to clarify than they try and muddle their way through and get it wrong.
I found the training with the other members of staff was very observational rather than them teaching me. It seemed a lot to take on over 2 10-hour shifts. You're chucked in at the deep end, but you are fully equipped to deal with the situation following that training. So I thought it was good and comprehensive and more than adequate. I'm very confident in helping Lisa. It does remind me of where I was only a few months ago, but I feel completely confident in being able to teach her. And I think if she's got the right temperament, she'll pick it up very quickly, and I'm sure she will.
The beauty of delegated healthcare tasks being taught to PAs means that Matt's got so much more flexibility in his care arrangements, and that he can come and go as he pleases throughout the day, and we can much more efficiently use the healthcare professionals that we've got, because the budgetary implications of having a qualified nurse here 24 hours a day would be impossible. For Matt, it would mean that he would have to live in a nursing home. Not a care home, but a nursing home with nursing care.
As a recipient of personal help with my families, had a major impact on my life. It's given me a lot more choice and independence in what carers I choose, what they're trained in, and how they assist me. I think without the personal health budget, it would have been far more difficult to move out of my family home and live independent, live with my partner. Also to set up my own business, and I think it's given me the sort of skills to move ahead in my life.